I would like to welcome everyone. Can you guys hear me?
Yes.
Yes, we can hear you. Yes.
Thank you very much. Thank you very much. Welcome everyone again to our monthly WHP, which is a Women's Health Promotion. Our slideshow, your reliable source of information, to promote your health and your well-being. Yes, of course, I am your sister, Nahila Ayeva. And with me today is my beloved sister, Dr. Jemilah. And we together will be presenting this beautiful, presentation, because this is a topic that is hidden and have so many questions about that. So without further ado, we would like to start this presentation. What is a breakthrough coronavirus infection? Wow. What is coronavirus breakthrough infection? Before we start analyzing what is that infection that has been going on, I would like to just make some quick points in here. Number one is that most people who get COVID-19 disease are unvaccinated. And the word here is the most. However, since vaccines are not 100% effective at preventing infection, some people who are fully vaccinated will still get the COVID-19 as a result of, other variable. This can be people with immune suppressant, and this phenomena can also do just because of, the fact that the virus itself is mutating, is changing. We can talk about, new virus, as you can see in the news. They previously talk about Delta variant, and now we're hearing about Omicron variant, and also more are coming. I just don't want to overwhelm you with that. So that can make the vaccine not be effective. And at the beginning, also remember, it's not 100%. So yeah, effective at preventing infection. Serious illness and death can be prevented because of the vaccine. But again, people who are vaccinated still have some form of COVID-19. And I'm sure you probably know somebody who will say, hey, I already took my vaccine. Not just my vaccine, I haven't even taken my booster, but I still come up with a infection or with a COVID-19. So, well, as I mentioned briefly, the break of infection is an infection of a full vaccinated person. Simple. What is that? When somebody already vaccinated and still have COVID-19 infection is referred to as breakout infection. Now, so why this happen? Well, like I mentioned again, it has to be doing with a variation or a new thread of the virus. As the virus mutate, create many different forms, it's kind of hard to, combat all the disease. Yeah. And also it can be that some people with the immune suppressant already going to therapy, such as cancer therapy or HIV therapy, and taking drugs, strong drug, do not have strong immunity to fight to have immunity to prevent the infection. Therefore, they can slightly have that. Now, one thing we have to understand that even when breakout infection happen, the vaccine still protects almost all people who are vaccinated. So it protects us from becoming serious ill or perhaps dying from the virus himself. Yes. So we will say that protection of the COVID-19 vaccine is very effective. Bottom line is what? COVID-19 vaccine protects everyone age 5 and older and gets severe illness, and this is including the diseases caused by Delta variant and also the new variant that circulated that also known as the Omicron and many other variants. And this is according to the CDC Center for Disease Control and Prevention. So somebody who take a vaccine such as the Pfizer BioNTech, also known as the Comirnaty, that is a brand name, it can be protect from COVID-19. Somebody who also take vaccines such as a Moderna can also be prevent and protect from COVID-19, and also Johnson, but not the least, also can prevent people from serious diseases, although currently there is a controversy around the effectiveness. So that being saying, it's still important that we take the vaccine, especially at this point. We recommend, or I can say that we have a preference of those two vaccines. Number one being a Pfizer BioNTech, and number two being Moderna. So far, if you have not taken your vaccine yet and you would like to take a vaccine, those will be the preferred vaccine. Although other vaccine also may work, but this is the preferred vaccine, especially when it's available to choose. We highly recommend that you choose those two. And even if you already have a Johnson vaccine, also known as a Jason, and you would like to take a booster, it's recommend that you take a Pfizer BioNTech at this point. So I would like to summarize a little bit about, what we know about vaccine breakthrough infection before we can move on how to prevent that with my colleague, Dr. Jemilah. So before we move on the preventive measures, I would like to really know what really they know about COVID-19 breakup infection after vaccination has been conducted. Or in other words, after a person already has been full vaccinated, and here full vaccinated referring to somebody who have taken a first dose, second dose, and also perhaps have even taken a booster. In the case of when the in case of a vaccine that requires two doses, such as a Pfizer BioNTech, meaning that the person already taken a first dose, second dose, and now they took the booster, right? And in the case of Jason, which is a Johnson vaccine, the person already been taking one dose and also take a booster, to prevent the COVID-19, but unfortunately found themselves having this infection, infection. We've seen that a lot of people has been vaccinated so much. So because it's a big number of people who have been vaccinated, we will also see the rising case of breakthrough infection. Because again, the more people vaccinated, the more the number increase. But when it comes to the ratio, it's still the same. So let's say it will be probably less than 1% of the population. Yeah. So let's say 100 people vaccinated and 0.1% have a breakthrough infection, or 1,000 people vaccinated and 1% have a breakthrough infection. It's still 1%. So we have to not letting those number or those people around us who already full vaccinated and come up with infection be the people who are influencing our decision making when it comes to preventing ourselves from this devastating virus. Yeah. So what do we know about vaccine breakout infection? Vaccine breakout infection are expected. Why? Because COVID-19 vaccines are effective at preventing most infections, but they're not 100% effective. Therefore, it will happen because it gotta be 100% effective in order for you to say, hey, this vaccine prevents that disease. And it's not just a COVID-19 vaccine, it's other vaccine. For instance, when we have to talk about influenza vaccine, which is a flu vaccine, is only have effectiveness of 60% highest and sometimes 40%. Still, Food and Drug Administration the government allowed that to be passed and still vaccinated people because it prevents severe cases of flu. So yes, but still some people would get the flu vaccine and still come up with the flu infection when we see that, right? Yeah, so that's number one that I would like to mention. And then moving forward, we also see that full vaccinated people with the vaccine breakout infection are less likely to develop serious illness than those who are not vaccinated. It's very simple. It's just simple. Yeah. If somebody is a full vaccinated and still come up with infection that we know today know as a breakout infection, the severity of the disease is mild in that person than the person who may come up with a COVID-19 diseases without having any previous vaccination. So even when we also know that what another thing we know about the breakthrough infection is that even when full vaccinated people develop symptoms, they tend to be less severe symptoms as well than in unvaccinated people. This means they are much less likely to be hospitalized, right? And then also fatality rate is minimal, which is that those people who are vaccinated and come up with infection don't die easily, and we don't see them hospitalized in a hospital. And if this case is happening, it's just to correct the symptoms, but not to be intensive treatment like somebody who is not vaccinated. We also know that people who get vaccine breakup infection can be contagious. So it's very important. It can be contagious. Therefore, we're going to move on the preventive measures. And at this point, I would love to call Dr. Jemilah to go ahead and continue with this presentation, and to tell us more about, the preventive measures. What can we do to prevent from breakthrough infection? Dr. Jemilah?
Thank you very much, Sister Nahila, for this beautiful presentation. There are numerous ways in which we can prevent the breakthrough infection. Very important one is the face mask. Even though we are fully vaccinated, we should ensure that we put on our face mask. Hand washing, it is highly recommended because, like we all know, the virus cannot stand on its own. The moment we wash our hands with soap and water, we wash it away. It is highly recommended. It is essential for us to wear our face masks to prevent ourselves and others. Putting on our face mask is not really easy. I can agree with you, but it is important. It is something we have to deal with because of the virus we have around us. Then the next thing we can think of doing is staying at least 6 feet away from others. 6 feet is like 5 arms length away from people that that don't live with us, strangers outside. It is important because the virus is very much around us. Another important preventive measure that we can take is cleaning of our hands often. It is recommended we wash our hands with soap and water for at least 20 seconds. That means we wash our hands under a running tap for at least 20 seconds. This is very, very important. But in a situation or in a case where we cannot or we are not accessible to water, and we know that we've touched some surfaces, we can equally use our hand sanitizer, which contains about 60% of alcohol. It could be more than 60%, but at least 60% of alcohol is also good for cleaning our hands. Avoiding close contact with people that are sick, is very essential. Even if we ourselves, we are sick, we have to make sure that we prevent other people that are not sick, healthy people, having contact with us. For instance, if we are in the house, we know you have, last time I had flu, and I have little children in the house. I had to ensure that I used my face mask, even though it was not easy, especially in the house around the kids. With my little baby, will be like, "Mommy, mommy, take it off, take it off." But I had to ensure this because I want to prevent the virus from reoccurring or reinfecting other members of the household. Like we all know, it is said that the virus within 3 to 5 days is likely to clear off. But if I don't try as much as possible to prevent the reinfection, after about 3 to 5 days, that means I'll be dealing with another infection of another members of the household. So it is essential to try as much as possible to use the face mask. It's not easy, but it's something we can deal with. It's better to deal with the face mask than to deal with the virus itself. I'm sure you can all agree with me on that. The next thing I would like to talk about is covering our cough, or when we want to cough or sneeze, we try as much as possible to cough in our elbow or in a tissue paper, and then we trash the tissue, then we wash our hands. You see, we are going back to hand washing because hand washing is essential part of medicine. It does not prevent only the virus, it also prevents other infections like bacterial infection, fungal infection, what have you. When the moment we wash our hands, and we try as much as possible to wash at least under a running tap for at least 20 seconds, we know that we have washed the virus away. Importantly for us to note is cleaning surfaces that are frequently touched daily. It is essential, especially now with the virus around. Like we all know, the virus cannot stand on its own. It needs a surface to stand on. So the moment we wipe the surfaces with the chemicals or disinfectants, we are sure that the virus has been cleared off from that surfaces. So it is important for us to wipe frequently touched surfaces such as our doorknobs, because everybody opens the door, the switches in the house, maybe the fridge or the freezer, refrigerator, the pantry, all those surfaces, the tabletops, those places that are frequently touched, we all know what they are. And another thing that we want to do is we want to disinfect our hair. We have to use hair disinfectants so that whatever thing we have in the hair, we let them out. Maybe we open the door, let them out, then we use disinfectant, even though if the doors are not open or the windows. So it is important for us to prevent the breakthrough of COVID-19. Another thing, or the virus generally, another thing is we all know that the coronavirus itself is it looks beautiful with its corona outlook, which gives it the name corona. But it is something we don't want to remain in our community. We have to try as much as possible to ensure the preventive measures. If we are fully vaccinated and we've not had our booster, we can have it because it can also help in preventing the breakthrough. We can see here our sister from Women's Health First going to masjid, cleaning the surfaces of the masjid. We do that. If we need any assistance with that, we can, for more information on that, we can contact our sister Nahila. She's readily available to help on prevention of the spread of the virus. I'll be concluding with this. And before we go to the question and answer segments, I would like to hand over to my sister Nahila, in case she has anything else to add to the presentation. Thank you very much for listening to me. Sister Nahila, over to you.
Thank you so very much, Dr. Jemilah, for this wonderful presentation. Indeed, you did all. I don't have anything to add. You said it all. It's very, very important that we continue taking the preventive measures, like you mentioned, to prevent us from breakup infection. So what people do is that once you get vaccinated, we're a little bit reluctant about continuing wearing the facial mask and washing our hands. And as the Dr. Jemilah mentioned today, she emphasized many times on hand washing is very, very important. So hand washing, wet washing, it's very important. All right. So I would like to thank all of you for your presence today, and I would like to also thank my co-presenter for this presentation and this research on sharing this value with us. And at this point, we would like to ask you to come up with the questions, some concerns, and anything that you may add to this presentation. Thank you, sisters.
Well, I think we continually need to take a very simple precautions, and that's the only answer. Life must go on, and just like the doctor said, we just need to take a precaution. Vaccination do help, but it looks like we're going to all have to take a booster. Seems like it's going to become a part of our life,
Thank you very much, Mama G. And like you said, sometimes the symptoms can be confused with the flu and with common cold. So that's why, like Mama G said, it's very highly recommend that we test for it. That's how sure you will know. Thank you, Mama G. Yes, wa alaikum salam wa rahmatullahi wa barakatuh. Beautiful. Is this Sister Zara?
Yeah, alhamdulillah. I just wanted to chime in real quick too, to kind of back up what Mama G was saying as well. And very good presentation to Dr. Jemilah, alhamdulillah. I stayed in my mask. She stayed in her mask. And I also have niqab. So I wore my niqab over my mask as well. And we were all still very COVID conscious, continuously washing our hands. They had hand sanitizer everywhere you went. So all I could do was make dua to Allah on my way home that, I didn't catch anything from my niece. So now being home 3 days, mashallah, I don't feel anything at all. I was just grateful that I had been taking my black seed every day while I was there anyway, my vitamin D every day. And like I said, consistently washing my hands, wiping down doorknobs and handles, things of that nature. So just going back to reiterating the precautions that we have to continue to take, because it was just unbelievable that my niece tested Sunday and was negative, and then turned right back around on Wednesday and tested positive. And my sister was still negative. My other nephew, my great nephew, her son, he was negative. But just my niece and my nephew, they tested positive, but just still 3 days apart. So you don't know how it can just creep up on you so fast, who you're actually getting it from. And it was a lot of us coming together for this service. And we were coming from different states. I have family members that came from Virginia, family members, of course, that came from Atlanta. We're in Detroit. A couple other family members came from New York, where we all originated from. And so it's very good to even hear that they're all back home and no one else has said that they're positive. So, alhamdulillah, like she said, just continue to do the best that you can do and really be COVID conscious and really not take it lightly, as maybe some of us may have in the past. Inshallah, I'll keep making our du'as and trying to be cautious of ourselves and considerate and cautious of others as well. Inshallah.
Thank you very much. That's a very great point. The word that we need to take from this commentary is that be COVID conscious. You said, oh, absolutely. And especially Sister Zara says something very interesting. This time is very important for us as a Muslim woman. We have a privilege to, even if we don't wear niqab, to fake it. Because of on the top of your facial mask, you can also have a niqab, and then everything is covering.
And I sell them too. I sell them, by the way.
Mashallah, thank you. Dr. Jemilah, you would like to add something to that before we take further questions?
Yeah, thank you so much, Sister Zara. Thank you, Mama G, for the addition to the presentation. I just want to say that even though we are fully vaccinated, even though we've had our boosters, we should also try as much as possible to keep the preventive measures. They are very essential. Like some people, they'll be like, I'm fully vaccinated, I've had my booster shot, I don't need to wear my face mask. Please make sure you put on your face mask beside them, because they might not really break down with the infection when they actually get the virus, but they can still transmit the virus. You understand? So you don't want somebody to give it to you. You don't want to spread it to other people. So it is important we try as much as possible to keep the preventive measures. We keep ourselves and our families, our neighbors safe. Thank you.
Yes, I have one question for Doctor.
Yes.
Yes, ma'am.
So same incident that I was telling earlier, like in 2 days, it'll tell you, oh, you got it. And next 2 days, 24 or 48 hours later, it said, you don't have it. What's up with that? I mean, it's a doctor question. So, I mean, how could that be? In 48 hours, she feel like she's going to die. And 48 hours later, they'll say, oh, you're fine. You're okay. Go home. So what's the answer for that, doctor?
Yeah, thank you so much, Mama J, for this beautiful question. Actually, she tested in 2 days, but she does not know the day exactly she got infected. That's one aspect I'm looking at it. Or perhaps she did the testing too late. It's possible she must have contacted the virus earlier than when she went for the testing. We might not even know that we had COVID if we actually not, getting tested for it. And that is, I go back to the word again, hand washing is very, very important. We may touch something now, we don't know, we rub our face, we put our hand in our mouth. We don't know, we're already infecting ourselves. So, but by the time we wash our hands regularly, by the time we use our face mask, it's like we are also tying our camel, to prevent ourselves from being, infected. So I hope I've been able to answer your question, Mama G.
Thank you very much.
Yes, darling, you did. And you sound so comforting. Have a personality there. Thank you.
You're welcome, Mama.
Yeah, thank you for Mama G for the beautiful question, and thank you, Dr. Jemilah, for the wonderful answers and with the clarity. Thank you. I would like to call on Dr. Yusuf. Dr. Yusuf?
Yes, can I hear?
Yes.
Assalamu alaikum, sisters.
Wa alaikum salam.
It's been very interesting, always interesting, very educative. We thank our sisters for all the information. Sometimes we think we know it all, but we never know it all. Just continue to stress the education. Our people need to be continually educated. We should know that this COVID-19 is here and it is not over yet. We must still be very vigilant, in spite of the fact that we've taken the vaccines, even taking the booster. So we must continue to stay vigilant, continue to protect our loved ones by going through all the prevention purposes. A lot of people just wear masks. That social distancing is just, I think it's a very big challenge. Even for me, you wear masks, but you still go to parties, you sit down next to each other, you want to eat, you only remove the mask and put it back. It's so so challenging. May Allah help all of us. Thank you so much.
I mean, it's just kind of hard. Like Dr. Jemilah mentioned, it's hard, it's challenging, it's not easy to do. You may wear the mask all day long. For 1 minute after you finish drinking water or eating, that's it. All the other people around you, there is no more a mask. May Allah protect us. May Allah protect us.
Amen.
Thank you, Dr. Yusuf. Any other sister would like to share? If you are listening and you cannot talk, that's fine, because Sister Priscilla, she tests back and she says she cannot talk at this time. Is Sister Zulifa would like to say something?
Assalamu alaikum.
Wa alaikum salam, lady from New York.
Oh, alaikum salam to la barakatuh.
Yeah, your state is, COVID state.
Yeah.
MashaAllah, but you guys are fighting it badly.
Allahu Akbar.
Allahu Akbar. Your governor
Allah
does
is in
not play.
control. That's all I can say.
Amen. That's true.
Well, nothing else to say. You guys said it all. Such an amazing presentation. Straight to the point, concise, most important information out. We got it. Take it and, put it into, application. That's it. That's all I can say.
Thank you so much. Thank you.
You're welcome.
Yeah. I would like to just make a little comment that CDC is currently collecting data on vaccine breakout infection, and it is closely monitoring, because they also do that to see the safety and effectiveness of the vaccine, and they be sharing data with Food and Drug Administration. Food and Drug Administration is the leading agency that will make a decision to for the vaccine to be remain on the market or to be removed. So far, they're saying that it's working and it's much better than the disease itself. So and also they mentioned that, as we discussed, that because vaccines are not 100% effective, as the number of people who are full vaccinated goes up, the number of this vaccine breakup infection will also increase. So just be careful. So that's what very important, as Dr. Jemilah mentioned. It's crucially important that we continue washing our hands. If anything, hand washing is more important than anything else. Hand washing, because not everybody will be able to wear and continue wearing a facial mask. Probably they may have emphysema, breathing problem. Is okay, but hand washing and social distancing with the people who are not your family member is really crucial. It's very important, So, like I say again, as the more people get vaccinated, we will see number of a breakout infection increases. So if you have been fully vaccinated and you come up with a breakup infection, do not just stay. Report it. On your vaccination card, there is a Center for Disease Control Information, and also HSS, which is the Health and Human Services. There is a data collection. Call them. There is a number. There is a thing. Let them know that, hey, I came up positive. And also, I will share with our WhatsApp group. I think I already shared. We will send it again. We have a government site that currently giving a free COVID-19 test at home. When you just order, they will send you four by address, four by house, by address. So they will send those testing kits. Use them, order them. They'll come to you and test. Go for testing. If you have any symptoms, test. And if you already have a vaccine and you test positive, please report it. Even if it's a mild, even if you don't have a severe, report them, because they're collecting data for the purpose of improving the vaccine. So it's very important that we know that this will happen and is continue to happen. It's not just because of COVID-19, it's also with the previous vaccine, So because again, vaccines are not 100% effective. Yeah. However, again, the risk of infection remain much higher, sisters. It remain much higher for unvaccinated people than those who are vaccinated. It's very important. So no one could say, oh no, no, you can't compare yourself with those who are vaccinated. You can. even though they have infection, is a mild. So again, the risk of infection remain much higher for unvaccinated people than those who are vaccinated. So that being further ado, we would like to conclude this presentation, and we would like to thank you very, very much for taking time out of your very busy schedule to join with us today again on this wonderful topic. And we count on you to really share with the family members and the friends in the community. Yeah, this is very important. And a reference we use is those site, CDC site, and also Food and Drug Administration, and then the prevalence data collections. Those are some of our research data from the, yeah. And then again, before we depart, I would like to thank again my colleague, Dr. Jemilah, for this amazing presentation, being my co-presenter today, and also taking the opportunity to thank you again all for coming. Until this time.
You're welcome, Sister Nahila. Thank you for the opportunity. Thank you. May God bless you. This is a laudable
Thank you,
program.
Doctor. Appreciate.
Welcome, ma'am.
All the ladies, I must say salam alaikum because we have in Texas is Asr time now. So I'm going to go pray. Yes. Inshallah, we will meet soon. I'm sorry I'm missing Rabbana Dua today. I don't know if you have it today.
Today is not a Rabbana Dua. Today is public health.
Okay, inshallah. Take care, everyone.
Thank you, Mama G. We always love it to see you. All right.
Nah, I'm a Mama G.
Inshallah. Now. All right. Without further ado, we would like to say bye-bye. Ciao, ciao, everyone.
All right. Salam. Good night.
Wa alaikum salam.
Wa alaikum salam. Ladies.
Thank you very much, Sister Zara, for your beautiful input. We always appreciate you.
Yes, and likewise, my sisters. Inshallah. Okay, so alaikum rahmatullah.
Wa alaikum salam wa rahmatullahi wa barakatuh.